Senator Cormann.
Thank you, Mr. Deputy President. I also rise to not take note of the answer provided by Senator Ludwig. In his answer today, the Minister has again tried to defend a bad public policy decision by ignoring the facts and actually totally ignoring the impact on our public hospitals. And I'll explain. The challenge for any government is to set up a policy framework that will ensure that all Australians have affordable and timely access to quality hospital care. Now, in Australia, the way we aim to achieve that is through a mixed health system with a public hospital component and a private hospital component. Now, when we last came into government in 1996, that system was totally out of balance. In 1996, private health insurance membership was in free fall. It bottomed out at 30% before we were able to turn the ship around. And how did we turn that ship around? Through a three-pillar policy supporting Australians that were prepared to take additional responsibility for their own healthcare needs by taking out private health insurance. Through the 30% rebate, through lifetime health cover, and yes, through the Medicare levy surcharge policy. Now, and that policy was successful. It was exceptionally successful. In the 12 months between December 2006 and December 2007, 200,000 additional Australians took additional responsibility for their healthcare needs by taking out private hospital insurance. By December 2007, 9.4 million Australians had taken out private hospital insurance. Now, and here we've got the government that comes up with a Treasury-driven bad public policy which is ill thought out, which is short-sighted and which will have a devastating impact on our public hospitals. Now, what did we find out in the Senate estimates process? One, Treasury actually didn't understand the difference between what is called in industry jargon single equivalent units and persons covered. Single equivalent units, adults. Persons covered, adults including dependent children, which is of course why the Treasurer was out there for weeks on end trying to tell the Australian people that 485,000 people, only 485,000 people, would leave private health insurance as a result of this measure. We've found out since then that of course it's going to be significantly more. It is going to be well in excess of 700,000 people. Now, we then tried to assess the impact on public hospitals. Now, the government actually, if you look at the budget papers, expects to save $959.7 million as a result of not having to pay the private health insurance rebate to those Australians that will leave private health insurance as a result of this measure. Yes, there will be a loss in revenue of $660 million, but that means the government is still $300 million in front. Now, the minister today said, oh, well, you know, we're providing a $600 million package to compensate for this and reduce waiting lists. How misleading was that answer? Because if the minister will have a look at his own budget papers, there is $300 million, which is made up of a first stage, $150 million to immediately reduce waiting lists. The second $150 million is actually funding into infrastructure and not into services. And the second $300 million is actually only available if the state governments meet certain performance targets. Now, with the impact of this measure, there is absolutely no way that the states can meet those performance targets, and the states will never be able to get access to that $300 million. So, quite frankly, this is just a farce. The Commonwealth actually has a cost-neutral position on this. Now, as a result of this measure, $960 million no longer having to be spent by the Commonwealth as a result of people leaving private health insurance. That is only the 30% private health insurance rebate. So the total funding lost to the health system as a result is well in excess of $3 billion. $3 billion. Now, when we ask questions in estimates whether the Commonwealth had consulted with the states or modelled, costed or in any way assessed the impact of this measure on state public hospitals, what was the answer? No, we haven't. Treasury said, we don't cost or model or assess second-round effects. Now, what a joke. Second-round effects? There's a tsunami of additional demand about to hit public hospitals across Australia. We had a Prime Minister who, in the lead-up to the election, was telling the Australian people that he would end the blame game, that he would start a new era of cooperative federalism in health, and here they are taking $3 billion out of the Australian health system. without any meaningful compensation and just by trying to hide it through some smokes and mirrors. It is an absolute disgrace, Mr. Deputy President, and quite frankly, there is a very serious need for some additional scrutiny on the impact of this measure.
Your time has expired, Senator Cormann.